you think about this image of a couple of doctors like mopping up the floor with a bunch of water on the floor, and in the back there's a sink and the water is on and overflowing the sink and is all over the floor, but the doctors are there mopping up the floor. That's basically what we're doing. We're mopping up the floor with all this medicine when all we need to do is turn off the sink.
Hi, and welcome to another episode of Civic Pulse, Politics and Everyday Life. And today we're going to be talking to Beth Polk about lifestyle medicine, something that really impacts this community. So, Beth, I am going to let you introduce yourself to our viewers and our listeners.
Sure. Yeah. So I am a family physician who's also board certified in lifestyle medicine, which basically means I spend a lot of my time talking to people about how to improve their health with their lifestyle. So things like diet and exercise and sleep and things we'll get into a little bit more, I'm sure, as we talk more, Trish. I'm also I'm an associate professor at the Virginia Tech Carilion School of Medicine as well. And I work in the family medicine residency program. So I also teach medical students and residents.
Well, you are absolutely the right person for us to have this discussion. You're certainly qualified, and I know you've got some good answers. And I think you're going to be talking directly to a lot of my listeners and viewers, and I am one of them, especially about diet and exercise. So we're all trying to get there. So let's just dive right in, Beth. I have one question here I wanted to ask you. Let's start with the basics. What is lifestyle medicine? And why should the average person care about it at all?
Sure. So lifestyle medicine is defined as using evidence-based lifestyle interventions in order to prevent and to treat, and in some cases to reverse chronic disease. And why should we care about it is that of the top 10 causes of death in the country, the top 2 are still heart disease and cancer. But the rest of the top 10, 8 of them are all directly related to lifestyle.
Wow.
Things like how we eat, how we move, how we sleep, how we manage our stress, our social connections and substances that we use. Those are the areas that we focus on in order to help people build the skills that they need to be able to take care of themselves. And we should care about it because at some point, all of us, or if not us, somebody we know or love is going to be affected by one of these things. And we have the power to be able to intervene and do something ourselves. We're not reliant on the medical institution to do that for us.
Well, that was the one key word out of that sentence. Power. We actually have the power to do it ourselves. And I am one that really didn't like taking medication or still don't like taking medication. My mom was the same way. You know, you take an aspirin if you had a headache and lie down if you had to. But a lot of people really don't want to take the medicine and or beyond prescription drugs. And so we have alternatives and we have options. So we want to talk about some of those. So how did you personally get involved?
Sure. So I've been a family doctor for close to 30 years now. And I spent a lot of time talking to people about these various things. And what I found, I went into medicine because I wanted to help people, wanted people to be well. And I found that the longer I did this, the more I realized that everything we were doing for people, yes, it was helping them. Sure, the medicines help people. They keep them alive longer. And they sometimes really make a big difference. And yet, I'm not actually healing anybody. Like, nobody is really getting better and thriving. We're just managing their disease until the point where they eventually die from it. And that was very frustrating to me personally. I also got into it for my own health. I started thinking about myself and, all the toll that medical training takes on us and everything that we do throughout our lives and how that affects us. And I thought, I want to live a long time and I want to be here for my kids and my grandkids and hopefully my great-grandkids. And so, in order to do that, I have to do the things that help me live a long time. And so that's for personal and for professional reasons that I've sort of started to focus on this.
Well, and that's a really good reason. And I'm glad you pointed that out because I'm sure as a medical professional, it is frustrating when, you really, I mean, medications, you can see some progress, but they don't all work the same for
No.
everybody. But I think with lifestyle medicine and, diet and exercise and all of those things,
Mhm.
everybody's body pretty much works the same, but those medications don't really have the same impact on
Yeah.
different individuals. And I'm not a doctor. That's just my perspective. And you're gonna dive into it more for
Mhm.
us. But I think that it's a wonderful thing, and I appreciate you transitioning to lifestyle medicine. I'm sure it has made a difference for not just for yourself, but a lot of your patients. And are you still treating in that fashion?
Yeah. So I still see patients. I see patients for focused lifestyle medicine visits where we spend our time just talking about that. But I also still have a panel of patients that I see, one that you might consider regular medical care. However, I tend to still infuse all of this into my practice, regardless of whether it's a focused conversation around it or just giving people resources or teaching them something about how to do it. So that's all throughout my practice now and what I teach residents, but it's also focused too. So it's both.
It's both. Well, let me ask you this. Can you share a story of a particular patient that or client who has changed their life dramatically through these lifestyle changes? Not
Yeah, I mean,
not
yeah.
medication or surgery.
Yeah. There are many. The one that comes to mind off the top of my head was an older gentleman who had been trying to work on his diabetes and his high blood pressure and his weight for quite some time and just hadn't really been very effective with it. And through working together and the with working on goals, we set goals and we try to progress along the path. He has over the past, I guess it's been about 6 months now. He has significantly improved his diabetes control. He's decreased his blood pressure medication, and he's lost, I don't know, 40 or 50 pounds. And
Oh.
that is all through small steps. I mean, this is not necessarily about coming in and like doing a complete overhaul and changing everything you're doing overnight. It's about how do we start to add the right kinds of foods and how do we start to add movement and how do we improve sleep and how do we start working on all these different areas so they start to harmonize together to get the effects that we're looking.
Well, my sister, she actually lives in Florida, and she is diabetic, and she when she visited me last summer, she was on insulin.
Hmm.
And she visited me recently for a funeral, not I guess a couple months ago, and she said, um, I am no longer on the insulin.
Hmm.
I just changed my eating habit because I said to her, I said, don't you have to have that insulin and stuff like that? Because I don't want you to forget, there's a lot going on." And she said, "No, no, no, no. I'm not on the insulin anymore. I changed it with my eating habits." And when she got ready to hit the road to go back to Florida, she had a bag full of carrots, celery sticks, and things like that. That's what she snacked on all the way. And she would just eat that, bags of it at night, you
Hmm.
know. And so I'm really glad that she was able to do that. And I don't know how she figured it out. I don't know if a doctor told her to do
Yeah.
that. I'm pretty sure someone encouraged her to do that because she's like me. We love pie and ice cream, et cetera, at night. But she completely changed her eating habit, and she said she still has to take medication, but she doesn't have to take the insulin shots, which was very
Yeah,
important.
that's not an
Oh,
uncommon story. I mean,
yeah.
it's really quite remarkable if you start to make significant changes in your diet. We think about lifestyle. I think about lifestyle the same way I think about medicine. To me, lifestyle is equivalent to medicine, and actually, in some ways, it's better than a lot of prescriptions that we use. But if we take a small dose of change, then we get a small response. But if we
Right.
take a bigger dose of change, we get a bigger response. And so that kind of thing you're talking about where people really make a radical change in how they eat, can get people off insulin in relatively short amount of time, actually.
It
Um,
did for her. Was it within a year? So I mean, that was a great story that you shared, and I wanted to add because I had a
yeah,
similar
it's
story
fabulous.
about my sister. Let me ask you this: what are the main pillars of lifestyle
Mhm.
medicine,
Sure,
and how do they affect our everyday health?
sure. So there are 6 areas. The American College of Lifestyle Medicine, which is where my certification is through, divides that pie of areas into 6 pillars. You could divide it many different ways, but the way they divide it is that way. So the first one would be nutrition. And in nutrition, we talk about a plant strong or a high fiber diet. Doesn't have to be vegetarian, but we try not to focus primarily on meat and just less on meat, but more on adding the fiber. So adding fruits and vegetables and beans and whole grains. And really, most importantly, also getting off of the packaged food, the ultra processed stuff, the fast food, the sugar sweetened beverages, those things are all directly undermining our health. So if we could get rid of those and add the fiber, that's sort of the way we focus in nutrition. And there's a resource that I'll share with everybody because it's free and I give it away to everybody that I see. It's a free website called Full Plate Living. And on that website, you can learn all about how to sort of transform your diet toward a more fiber-filled, healthier diet without it being, it's gradual, it's kind. It doesn't require.
We need gradual, and I will certainly add that link.
Yeah, you do add fullplateliving.org. It is like I said, it's a free resource. They've got tons of material on there, and I give it away to everybody I can because it's so helpful and effective for people.
Okay, for those of you that are watching, don't worry about trying to get it down. It will be included at the end of the podcast in a link, so you can just go directly to it. Thank you. Thank you for that.
So that's the sort of the primary focus of nutrition. Movement or just general movement includes being just generally active throughout the day. So that's where we look at things like step counts and that kind of stuff. Although I don't get fixated on that, as if you're just moving throughout the day and not being sedentary. And then also adding onto that some cardiovascular exercise and some strength training, particularly for women who tend to not strength train. Strength training is really important for our health, maintaining our muscle mass as we get older, make it less likely for us to fall and break a hip or injure ourselves or end up frail in a nursing home someday. I mean, those are the trajectories that we see a lot. And if we're not paying attention to our muscle, we lose it as we get older. So just moving, not sitting, cardiovascular exercise and strength training are the 3 parts of the movement piece. Sleep. Go ahead, finish.
No, I was going to say, yeah, that strength training. I used to be able to carry up a case of water in my office. We were on the 2nd floor. And now I have to break it up and put it in a bag and then bring the rest of it up. So yesterday, I swear to you, I actually started yesterday back with strengthening.
There you go.
With the strength training. I asked my son to come out and work with me. My husband goes in the morning. I go in the morning. I work.
Right.
For work. I've got to do what if it's going to happen, it's going to happen in the evening. So, we've got to carve out some time to do that. I know it's important. I cannot believe that I cannot carry this case of water. I want to get that. I'm too young not to be able to do that at this point. I know at some point, who knows? I have a friend who still hikes and does all this stuff. She's like 70 something years old. So I think we can all be like that. We just have to stay focused and listen to some of the things that you just said. Yeah. And what else? What is on the next pillar?
Okay, so the next one, no, you're good. You're good. The next one I would say will be sleep. And sleep is something that I think our country in general undervalues. We tend to think of it as something we have to do, but we try to do as little of it as possible because we're too busy and all the things. But sleep is actually really foundational to most of what I'm talking about, in that if you're not sleeping well, it increases your weight, it increases your insulin resistance, so you're more likely to become diabetic. It makes your blood pressure go up. And that's just independent of your diet and your exercise. That just does that if you're not sleeping well. So most people need between 7 and 9 hours of good quality sleep a night in order to be adequately rested. And the third of the country only sleeps about 6 hours fewer. So we know that it's an epidemic out there of people who are not well rested. So that's really important to focus on. There's lots of tools around that to help people sleep better that I could share with you also, Trish, to put on your.
Yeah, well, definitely for getting better sleep, if there are tools, we certainly want to have them, because I know people take medication to help sleep. I know some people do other things, but that is something that we are challenged with is sleep deprivation, because we're just so busy.
Yeah.
And not only are we busy, there's so much going on that we are processing over
Yeah.
and over again. And so I know for a fact now, as soon as my head touches the pillow, I'm asleep, but my husband, not so much. And I know
Yeah.
other people complain about sleep deprivation all the time. So please share with us some tips
Absolutely.
on that.
Yeah, I have a one pager on sleep and diet and exercise I'll share with you. You can
That
get.
would be perfect. Perfect. Perfect.
Yeah. So the next pillar would be stress. And stress is something that we all live with. In fact, stress is, oh, I mean, you could go online and find a million things about stress, but we know that some stress is okay. Like some stress gets us to do things, but there becomes a point where it becomes more than is necessary. And it becomes overwhelming and it starts to affect our everything. So learning ways to manage stress is very important. So things like deep breathing, sometimes meditating, exercise helps manage stress, sleep helps manage stress. You'll see a theme here in that they all kind of cross over.
Oh, over. Yeah.
So they
Yeah.
all
Well,
go
what are your
together.
thoughts on acupuncture and stress?
Acupuncture is great too. I mean, yeah, acupuncture is a nice modality to add. And there's all kinds of things: Tai Chi, yoga, um,
Plain old
reading.
exercise.
Yeah, reading if you like to do that, doing crafts, petting an animal. I mean, there's like all kinds of ways to reduce stress. There's a whole list of things that you can do. And it really comes down to what speaks to you. But one little tool I'll just give everybody right now, which is a simple breath that anybody can do anywhere and doesn't require any training or knowledge to do. You just breathe in
Really?
for however much you want to breathe in and breathe out longer and slower. So
Yes.
slow down your exhale. So your exhale is longer than your inhale. That stimulates your natural, like innate relaxation response called your parasympathetic nervous system. We talk about the fight or flight. That's the sympathetic nervous system. That's the part that activates us. And that's where the stress kind of kicks in because we're pretending or feeling our body feels like we need to react to something, even if there's nothing really happening. It may just be a circumstance in our life rather than an actual tiger chasing us.
Oh,
So
right.
the opposite of that is our parasympathetic nervous system. And you can activate that anytime by just breathing in and breathing out longer. And so just doing that when you're in or you're standing in the grocery line or your partner or your friend has just irritated you and you can just do the rhythm.
Well, that,
Just
just take a moment to pause
yeah, you
and
don't have to
breathe.
think about it. You just do the breath and it will turn that relaxation response on and you can maybe approach the situation from a much better place than you
Well,
would have otherwise. Yeah.
we hear that all the time, and I know it sounds so easy. Just stop, pause, and breathe.
Yeah.
Um, and I'm sure that it's so key that we do that, but people just don't take time. I don't take that kind of time. I mean, we're just nonstop all the time. But I'm glad that you're reminding us to just pause
Yeah.
and
It's a
and
practice.
breathe.
Yeah, it's a practice. It's all, it's like any of these things. It's something you have to start to do and try to figure out a way to make it become a habit. And that's okay.
Well,
Yeah.
we do the best we can
We
today.
do what we can.
I've waiting on something to upload on my computer. So I look down. I have some barbells by my desk that I've used 4 times,
There you
and I've
go.
been in this office 5 years. But I said, you know what? When I'm waiting, I can pick it up or
Mhm.
pick them up and do something for 10
Yes, you
minutes
can.
or so. I
Yep.
mean, you can do something. I am really trying reading over and doing a little research to prepare
Mhm.
for us to have this conversation.
Yeah.
um, it just prompted me to start thinking about things that I can do. I mean, just sitting there because I'm in an office. A
Yeah.
lot of us are, and I'm
Yeah.
sitting all day until I get home, and then
Yeah.
you know. But
One thing
anyway,
I tell people who sit a lot for work is to set an alarm on your phone to go off every hour. And if you haven't stood up in that hour, get up and walk around the room for 5 minutes. Just walk around where you are. You don't have to go anywhere. If you can't leave your desk, it's fine. You can march in place, but just stand up and move. Because we
all
get
in close.
stuck in, we get in the groove working, and all of a sudden it's 3, 4 hours have passed and we haven't moved, and that's not good.
No, it's not good. I know. I feel myself with a little stress there and a
Mhm.
little stress there,
Yeah.
and
Yeah.
we
So
all
yeah.
know where it comes from. So, did we get to all the
No,
pillars
there's
or
2 more. So
two
2
more?
more. There's social connection, and this is a big one. Having some connection to something outside of yourself. So that can be a purpose, a meaning. It's really, I ask everybody when I see them, what do you feel like life has purpose and meaning? That's a very important question because if somebody says no, that's a problem. You know, are you connected to family or friends? Are you connected to some sort of spirituality of some kind? Do you get outside in nature? Are you in any groups or clubs or organizations or just things that you're part of? All those things make us healthier. We know that people who live the longest and the happiest lives have the best relationships and social connections. So we know that that's really important. So I check everybody for that because there are ways to build that. If you don't, if especially you don't have to be a party person. You don't
Right.
have to be an extrovert. The introverts need friends too. They just maybe need just a few friends that they get to know really well, rather than a bunch of big groups of people. So
Oh,
it's
okay.
very individual.
Love that piece of it. I'm certainly an extrovert, and I'm in a lot of clubs, and sometimes that can be a problem too
Sometimes
because
you can
you're
overdo.
overextended, and that has happened. But I'm gonna make sure my husband watches this because he is volunteering now. He's retired and he is
Nice.
volunteering, and I can see the change.
Oh, yeah. Just being
He's
around other
stepping forward.
people is good for us. We're a social creature. We are intended to be around others. It just how that looks is a little different for each person.
That makes a
Just
whole lot.
on the over clubbing thing, I have a couple of people that I follow whose homework is to like make a list of everything they're doing and then put next to that which of these things actually bring me joy and which of them am I doing out of some kind of obligation. And so, like, going down this list and starting to eliminate some things that are not really bringing you joy and just there's a sense of an obligation can really free up some time now to do more for yourself, which a lot of
Oh,
women are overdoers, overgivers. And so trying to reel that in a little bit and turn some of that attention on themselves, which they're so used to putting out and not turning on themselves. Right.
well, I think that's 50% of my problem, and
Mhm.
most of it is obligatory, right?
Yeah.
It's like
Yeah.
I feel like I have to be giving back, especially someone who grew up, a single parent. My father was killed in
Mhm.
the Vietnam War,
Yeah.
and you want to give back to the community. I feel like
Yeah.
I've done well,
Yeah.
and you want to give back, and you
Yeah.
find yourself in 5 organizations.
Yeah. And
Um,
there's certainly nothing wrong with giving back. I think that's fabulous. I think we all need to do some of that. I mean, I think that's sort of an imperative. However, um, narrowing your focus enough so that you have space for yourself may or may not be a good idea.
Christine, I'm following you all the way with this thing. I
Yep.
am. I am. I'm
Yep.
following you all the way. I just
Yep.
think sometimes we are overcommitted. I celebrated a girlfriend's birthday for the first time on her birthday, and she was my maid of honor. I've known her for
Mhm.
almost 40 years, but normally it's 2 months later because
Your
I'm
calendars
trying to
don't lie, man.
understand where I'm going with this.
Yep. Yeah, I totally get it. Totally get it.
We're just so
Last area
busy.
to touch on is risky substance use. So certainly we all, I hope, are aware that smoking's bad. There's really no good benefits of smoking, so we try to get rid of that as much as we can. Alcohol is another thing. Alcohol. This might not land with people in the way they want to hear. I'm looking
In the
at
way that you intend.
and I way that they wanna hear because, we talk for years, we've talked in medicine about alcohol. Well, 1 drink for women and 2 drinks for men. Wine every day is healthy for us. It's actually not true. There's really no evidence that alcohol has health benefits. In fact, there's a lot of evidence that it's negative effects on our brain health, our sleep, and it also is associated with an increased risk of breast cancer. It's actually a class 1 carcinogen. So, there are negative side effect negative things with alcohol, so that I think that we as a health profession need to start telling people that any alcohol use is not necessarily healthy. Doesn't mean you can't do it. If you wanna do it, that's okay. Just know what you're doing. Understand what the risks are. And so maybe it's not an everyday habit, like I come home from work and I just have a glass of wine because the glass of red wine is good for me. I just have it on a special occasion or have it out when I'm out with friends, or I decide not to have it at all. And
Yeah.
that's okay too. And we sort of accept it as okay because it's such a part of our culture. And actually there's a lot of stuff
Sure.
coming to know that it's not. And then we don't need to spend a lot of time on other drugs, but there are other drugs out there.
Do you recommend um like a vegan diet or
Yeah.
vegetarian diet, or you think meat is okay, just kind of limit the meat?
I think it depends on the individual and their preference. You know, the there is data that shows that vegetarian and vegan diets are associated with really good health outcomes. So there is that. However, you have to take into account that a lot of vegetarian or vegan food is also not healthy. So, a lot of junk food out there is vegetarian and vegan. So it really depends on what you eat. So, for example, Oreos are vegan. So, I hope nobody would consider Oreos a health food, but maybe, maybe some do.
So, Beth, tell me, if someone were listening today, what would you recommend as one small change that would impact their health and change their lifestyle completely? Is there anything that you can recommend off the top of your head?
So many things. But if I could pick one, I would say maybe just start adding servings of fiber. So fiber is fruits, vegetables, beans, and whole grains. So pick whichever one you like. I don't care. Doesn't matter. Just start adding an extra serving of fiber every day. The vast majority of Americans are way underneath the fiber recommendation. We recommend at least 25, if not 40 grams a day of fiber, and most Americans get less than 10. So we want to
Wow.
make sure that we're adding fiber.
Add
And
fiber.
yeah, and
Add
it could
fiber.
be anything. I don't, it does. You don't have to go out and eat vegetables you don't like. Pick something you like and just start eating it regularly.
Okay, makes a lot of sense to me. That's the thing with healthy foods like sweet potatoes and spinach and beets and things like that. I told my husband, I said, you know what? We really don't like all of these things. We just have to find a way to prepare them
Oh yeah,
that satisfies us and makes us like them. So I'm doing a little bit better, but that was a good tip. Thank you for that. And I had
sure.
one other question. I
Mhm.
want to move on to chronic disease and some sort of hope. Let's give people some hope.
Yeah.
For those who are ready to get started, how can someone find a lifestyle medicine, someone who is informed, trustworthy, a good doctor? How could someone get started, and what would be the process for that?
Yeah. So, it's a growing specialty. So there are not that many of us, but we're around. So the American College of Lifestyle Medicine has a list of places. So you can go and put your zip code in and it'll tell you people in your area who are certified in lifestyle medicine. If you just want to learn on your own, you can go to the American College of Lifestyle Medicine website, which I'll also give you the link to that, Trish. Um, and they have all kinds of information that you can just get started by yourself. And and then just start talking to your doctor about it. I mean, many of us are not as well versed in the stuff as maybe I am, but most of us do know, ways to help inform and resources that they can give you around how to start having a healthier lifestyle. The issue is that we often are pressed for time. So if you ask, are willing to share. I can guarantee you. The question is, being able to get through all the things that we need to get through in an office business. Sometimes it gets left to the last and doesn't happen.
And
So,
doesn't happen. I
yeah,
I was I laughed because I thought, yeah, if you can get that in, sometimes you can't even
yeah.
get that conversation in. And
But
I'm
if
not
you
giving any doctor a
start,
hard time. They're all busy and they're
no,
all lined up. But that's
yeah.
I kind of snickered when you said that.
If
But
you go into the appointment saying, hey, I want to improve my health, can you point me in the direction of something? Can you
make that a
help me
part of the
make
conversation
it
from the
part of it? Make
start.
it part of what you're there for.
Yes.
Then you're sort of driving that conversation, and I guarantee you they know some things. We get some training, even if it's not enough. We can always, we can go on about all the different ways that we don't get trained enough in certain areas, but we all know enough to be able to share resources. And I'm
Well,
gonna give you some stuff to
I
post here. People can who
yeah,
see that,
we'll add all of those links. That's important
yeah,
information, and
yeah,
I'm excited. I mean, I really appreciate you coming on. Just some of
sure.
the things that you've shared with us already. I'm motivated to do some
Mhm.
things differently. I do have just a couple of questions, and we'll wrap it up.
Sure.
Well, my last segment here, the big picture and takeaways. Um, what's broken in our current
Uh,
healthcare system
yeah,
that lifestyle
right.
medicine could help fix?
Yeah. So probably the biggest thing that's broken is how we approach care. We tend to approach care in a disease model so that we look for disease and we treat disease. We don't treat from a prevention sort of standpoint. So we don't talk about the things that are driving the disease that we see. We tend to just talk about, here's the disease, here's the pill for it, and we kind of move on.
Kind of move
And
on.
so, yeah, what the way we think about it, if you think about this image, I would love to, I wish I could show it, but this image of a couple of doctors like mopping up the floor with a bunch of water on the floor, and in the back, there's a sink and the water is on and overflowing the sink and is all over the floor, but the doctors are there mopping up the floor. That's basically what we do. We're mopping up the floor with all this medicine when all we need to do is turn off the sink. And the sink is the faucet. And the faucet is all the things that we do every day that are driving our overall inflammation in our body and leads to bad health. So our diet, our exercise, our sleep, our stress, and all the things.
Love that illustration. And there it is. I'm showing you now. So we're going to be showing it. So we're showing you that now. So we'll
Yeah.
insert that. So, and my next question is, what gives you hope when it comes to health in our community, future generations? Overall, what motivates you and what gives you hope that this is actually working and can work?
So the stories that the people that I see every day who are learning and who are taking charge of their own health and they're empowered by this, that gives me hope. Because I see people getting better and that feels good. Also, I have hope for our future generation of doctors, and we are training doctors now to go out into the world equipped to be able to help people with their lifestyle in totally different ways than I was when I originally came through medical school. So I feel hope for the younger generation. And I also notice that our young people, even those not in medicine, are much more interested and engaged in this conversation than my generation was. And they're more proactive about their health in ways that my generation was not.
I
So
think you're right about that.
there's a
And that's
lot
why we're
of,
living longer.
yes. Yes. So I'm hopeful about all of that.
So, and finally, is there one thing that every listener or viewers
Mhm.
need to remember from this conversation, and what would that be?
Yeah.
Just
I
that,
would say,
just sum it up for us,
yeah,
Beth.
I would say the first thing to remember is that you do have some control and power over your health. It is not out of your hands to be able to take care of yourself and live a long life and be healthy and strong. You have some power, so don't feel like you're giving it away. And and you don't have to make huge changes to make big impacts. I mean, I said a lot of things today, so I gave you a lot of things, and I tend to do that when I talk to people. I give them a lot of things, but pick one thing, just one thing, doesn't matter what it is, that you want to do differently, and start doing it and be consistent. Because it's consistency over time that gets us results, not intensity. So start with one thing. Maybe it's fiber, maybe it's I start walking, maybe it's I sleep better, whatever. Pick one thing and start working on it and see the benefits.
Okay, so me personally, I'm going to do two things.
Okay.
Okay, I'm going to start that strength training, which I've already started yesterday, and I promise I'm going to try to continue with that as best I can.
Good.
And eat the fiber. And
There you
I
go.
know that we need fiber. I love beans. My husband cooked a pot last week. We just started doing that. We waited
Good.
until summer, right, to start cooking beans.
Sure.
But you know, better late than never. I know that's something that a lot of people like to eat in the wintertime, but you can have beans anytime, and they were lentils, and I didn't realize that you had black, red, green. I didn't even realize you had
Yeah.
so many different colors and types of lentils. So
Yeah.
those are my two takeaways, and I promise you I am going to stick to it. Beth, thank you again so much. I appreciate that. And all of the links that were mentioned, you will have access to. And I just appreciate you coming on. And until the next episode, live, love, and laugh. And hopefully we will have Beth get back again, joining us in the very near future.
Oh, I
We'll
would love
continue
that.
this very important conversation.
Yeah.
All
I
right.
would love that,
Goodbye,
Trish.
all.
Yeah. Thank you.
Thank you.